this is your first day of your anatomy class. Tell me, what is this? Skeleton. Okay. And how many bones in our body?
206.
And at birth?
300.
270 bones at birth. And in adult, it is 206. Okay. Now, bone is classified on the basis of is mainly axis as well as shape and size, development, and architecture. So first come to axis. This is axial bone. The skull, the vertebral column, as well as the thoracic case. Thoracic case constitutes 12 pair of ribs with the sternum. Only these. Thoracic case. This is vertebral column and here is the skull. This is axial bone. Rest of this is appendicular bone. This is upper limb and here is the pectoral girdle. Pectoral girdle is made up of clavicle and scapula. Pectoral girdle. The arm bone, this is humerus. Then forearm bone. On the lateral aspect, this is radius, and on the medial aspect, it is somewhat here it is. This is the यहाँ पे भी गलत है, ठीक है? This is medial and this is lateral, but this one is on the posterior aspect.
Yes, ma'am.
Okay. So ulna and radius, forearm bone. These are long bones. Okay. And this is carpal bones. From lateral to medial. See, looks too pretty, try to catch her. The mnemonic, that is scaphoid. This board-shaped bone. This one is board-shaped bone. This is scaphoid. Then lunate, too pretty, triquetral, pisiform. This is pisiform bone. See, looks too pretty, try. Again, from lateral to medial. This is trapezium, trapezoid, capitate and hamate. Okay, hammer shape, hamate, and the largest bone is the capitate of the the carpal bones. Okay, this is the carpal and now this is metacarpal. First, we will count from lateral to medial. Okay, first, second, third, fourth, fifth, and these are the phalanges. In the thumb, only 2 phalanges.
Yes, ma'am.
This is proximal phalanx, medial phalanx and distal phalanx. Okay. Now coming to pelvic girdle, it is made up of 2 hip bones and in the middle there is sacrum. Okay. And this one is coccyx. This constitutes pelvic girdle. And now the thigh bone, that is femur. Leg bone, in the lateral aspect, this is fibula, slim trim bone, and this one is tibia. And these are all tarsal bones. This is heel bone, this is calcaneum. Okay, and then this one is talus. Above the calcaneum, this one is talus. Then this is lateral aspect and this is medial. So laterally this one is cuboid and medially in front of the talus this is navicular. And these 3 are cuneiform. From lateral to medial it is lateral cuneiform, then intermediate cuneiform and medial cuneiform. These are metatarsal. Okay. So here is and these are the phalanges. Okay. According to the shape and size, bones are categorized long bone, short bone, flat bone, irregular bone. So long bones are, these are all, the humerus, radius ulna, femur, tibia, fibula. Long bone again divided into typical long bone, miniature long bone and modified long bone. Typical long bone are these. Why typical? Because it has got 2 epiphyses, 2 metaphyses and 1 diaphysis. But this is the example of miniature long bone. The phalanx and the metacarpal as well as the phalanx and metatarsal. Why? Because there is only 1 epiphysis, 1 metaphysis and 1 diaphysis and 1 medullary cavity. Here also medullary cavity. Okay. So what is the difference between typical long bone and miniature long bone? There is 2 epiphyses, 2 metaphyses, 1 diaphysis and 1 medullary cavity. Whereas in case of miniature long bone, there is 1 epiphysis, 1 metaphysis, 1 diaphysis and 1 medullary cavity. And this is the example of modified long bone, clavicle, because it has got no medullary cavity. Okay. And these are the short bones. This carpal bones and the tarsal bones. Short bones are rich source of red blood cell. Okay. And this is the example of flat bone. This triangular scapula. Flat bone as well as all the skull bones. These are the flat bones. RSVP. शादी के कार्ड में लिखा रहता है RSVP. तो rib, sternum, vertebra and the pelvic bone. These are the site for the hemopoiesis. Flat bones. Here lies the maximum hemopoiesis occur. Okay. And in adult, only this site, these flat bones taking part into the formation of take part in the hemopoiesis. Okay. And irregular bone, this is the vertebra. These are the irregular bone as well as the hip bone. How many vertebra we have?
26.
But you can say also it is 33. 30, yeah, 7 cervical, 12 thoracic, 5 lumbar, and 5 sacral, which unite to form 1, and 4 coccygeal, which unite to 1. Okay. And how many nerves? Spinal nerves?
11. 31 pairs.
31 pair. Always use pair. 31 pairs of a spinal nerve. Okay. So now this is the specimen of anencephaly. Here you can see these are the eyes. Here in black, this is eye, nose, mouth, but the head, it is not developed. Mostly the brain stem and cerebellum is developed, but cerebral cortex is not developed. This result due to the neural tube defect. Our neural tube, a copy though. Our neural tube is entitled for the development of brain plus spinal cord. Copy ला रही है. अच्छा. तो this is a neural tube defect due to the failure of closure of neural tube. Suppose this is the neural plate. Okay, neural plate. Now a midline groove is developed. Midline groove, and these two margins now elevating and form neural fold. At this stage, what is there? Neural groove, and there are two neural fold. Now these two fold approximate with each other. Approximate with each other, just like this. You can see here is one tube is formed. So just like this, the neural tube formation occur, and fusion starts from the middle point of the neural tube, and it progresses superiorly and the inferiorly. And this anencephaly results due to the failure of fusion of the neural tube, okay, which occur at 25th day of gestational period. And this is the caudal end of the neural tube which fuses at 27th day. So there is some problem. There is might be mother has taken teratogenic drug, or she is taking alcohol, or there is folic acid deficiency which lead to neural tube defect, and it is on the 25th day, which I want to mention. That's why an NK result. And you can see here, this is umbilical hernia. Here the mass is coming out from the umbilicus. It is very commonly, anencephaly is very commonly associated with omphalocele. Umbilical hernia is what? Omphalocele. The intestinal part is just protruding out from the anterior abdominal wall defect. Anterior abdominal wall is not developed, not fused. So the abdominal content is just protruding out and lead to umbilical hernia. Okay? Very interesting specimen. Okay?
Yes, ma'am.
This is what we are seeing. The model of, it is human body, and this is our inferior vena cava, and this is abdominal aorta. We will consider the arterial system in this model and venous system in this model. Okay? Just look at the arterial system. It starts as the ascending aorta, then it forms an arches, that is arch of aorta. Okay? This is descending aorta. Just behind the heart, here is the descending thoracic aorta, which is not visible here. Descending thoracic aorta, because this is the thoracic cavity. Above the diaphragm, this is diaphragm, abdominothoracic diaphragm. There are 8 diaphragms in our body. I will tell you later on, but this is the diaphragm, that is the abdominothoracic diaphragm, which separate thoracic cavity above and the abdominal cavity below. Okay, and now this aorta, descending thoracic aorta, it enters into the abdominal cavity at T12 level. Very important. Always remember, at T12 level. And now it forms the abdominal aorta. It bifurcates at the level of L4. Very important. L4. T12 to L4. Into the common iliac, then external iliac, and going to the pelvis is the internal iliac. Coming to this side, inferior vena cava, it is formed by the fusion of common iliac vein. Always mention arterial system from heart progressively downward to the periphery, because arterial system is centrifugal system. They are going to the tissue for supplying oxygen and nutrition.
Yes,
but vein are collecting. These are the centripetal system. So always tell that it is formed by the fusion of. And here we start from the heart. Okay. So let's come to this point, that inferior vena cava is formed by the fusion of common iliac vein. These are 2 common iliac vein at L5 level. Here what I have said, L4. But here it is L5 level. And this is our inferior vena cava. Here it crosses the diaphragm. Here we can see it crosses the diaphragm at T8 level. Abdominal aorta T12. Okay, inferior vena cava T8. T8 is what? 8th thoracic vertebra, at the level of 8th thoracic vertebra, है ना?
Yes, ma'am.
जहाँ भी नहीं समझ में आएगा पूछोगी उसी समय, ऐसा नहीं कि हाँ नहीं पूछ रहे हैं. ठीक है, तो T8 level, and now it enters into the right atrium. This is right atrium, and here is the superior vena cava, which brings deoxygenated blood from the head, neck, and the upper limb and upper part of the thorax.
Yes, ma'am.
Okay, and there is also a zygous vein which is not shown here, which is a communication between the inferior vena cava and the superior vena cava. Okay?
Yes, ma'am.
So these are the, and always say these are the branches of arteries, and in case of vein, these are the tributaries of vein. Always use this word, tributaries of vein. And in case of artery, these are the branches.
Branches of arteries.
Yeah. Here is the centrifugal system.
हाँ.
From heart it is going to the tissue, and from tissue it is going to the heart. So it is centripetal system. Vena system is a centripetal system. Diaphragm, it pierces abdominal aorta at T12, but inferior vena cava at T8. It bifurcates into the common iliac artery at the level of L4, but inferior vena cava, it formed by the fusion of common iliac vein at the level of L5. Okay? Start here. This is what we are saying is the model of human torso. Torso is what? Is the main, the central part of the, except the limbs and head neck, this is torso. But here it is, head neck is, it can be separated, but what we are seeing here, this is a cerebral hemisphere. What is this? This is cerebral hemisphere, and this is the superolateral surface, this is medial surface, and this is inferior surface of cerebral hemisphere. This is mid-sagittal plane. We have got two cerebral hemisphere, and in the mid-sagittal plane they are uniting with each other. Okay, and this is what we are seeing is the brain stem. This is, here is the midbrain, this is pons, the elevated one, and then comes medulla oblongata, and here is the cerebellum. This is in pink color, this is corpus callosum. Okay, here is the thalamus. This one is fornix. These are the lateral ventricles. Okay, these are your previous days, so you will be unable to understand much. And here we can see the oral cavity. This is tongue. This is submandibular gland. Here it is sublingual, and this one is submandibular. Okay, just beneath the tongue, this is sublingual, and here is the submandibular. Okay. Now, the pivot is not shown. Here you can appreciate the midline structures of neck. This is in orange color. In orange color, this one is hyoid bone. Okay, this is hyoid bone, and here is this is base of mandible. We will start from the base of mandible. This midline is the symphysis mentae. Okay, and what we see in the midline, this is the hyoid bone. Then after come, this one is thyroid cartilage, also known as, this prominence is also known as Adam's apple, which become very prominent in case of male. Okay, and this one is thyroid gland. This one is thyroid gland, and here is the inferior thyroid artery. Okay, inferior thyroid artery, and this one, here is the superior vena cava. Then this is brachiocephalic vein. In the right side, this is the right side, so right brachiocephalic vein, and this one is left brachiocephalic vein. L for left, L for longer. Long. This one is long, left one is long. Now it divided into internal jugular vein, and this one is subclavian vein, collecting deoxygenated blood from the upper limb. Subclavian vein, and this is internal jugular vein. But in case of artery, here is the brachiocephalic trunk, which divide into the, here is the common carotid, then again it bifurcate into internal and external carotid, and in the upper limb. Here you can see this is the subclavian artery, and later on it becomes the axillary artery and then brachial artery. These are the continuations. Okay, these are two lungs, the right lung and the left lung. This is our heart. In the right lung there are many variations, but commonly there are, in the right side there are two fissures. That is, this one is oblique fissure and this one is horizontal fissure, but only oblique fissure in the left lung. But this is not the criteria to distinguish between right and left. We differentiate right and left lung on the basis of its surface and border, not via the fissure and lobe, because they are variable. Even in the right side there may be only one fissure or two lobe. They are very variation, but mostly there are two. So we always differentiate. Always mind my words. We will differentiate right lung and left lung on the basis of its surface and border, not by the fissure and lobe.
Okay.
Now, inside the abdominal cavity, this is liver. Okay. This is interlobar notch. This is right lobe of liver. This is left lobe of liver. Here is the, in green color, this is the gall bladder.
Gall bladder.
Okay. And here is the small intestine, which is protected by large intestine from the periphery. So what is the continuation? First there is esophagus, then it becomes a stomach, then duodenum. Small intestine has got three parts, that is duodenum, jejunum and ileum. Then after ileum there is ileocecal junction. Then comes cecum, from which on the posterior aspect there is appendix. Cecum, ascending colon, transverse colon, descending colon. Here is the S-shaped sigmoid colon. Okay. Sigmoid colon. Then rectum and then anal canal. Okay.
Start.
This is pectoralis major muscle. In the pectoral region, what are the muscles? Pectoralis major, pectoralis minor, serratus anterior and subclavius. And this one is pectoralis major. Okay. And here is the mammary gland. This is nipple and this is areola. Okay. And on the internal aspect, what we are seeing? This is the sternum, internal surface of the sternum. These are ribs and these are the intercostal muscles. In between the ribs, these are the intercostal muscle. And just look at this butterfly shape. This is transverse thoracis muscle. This is from the lower part of the sternum. This muscle is just spreading out. Okay. Transverse thoracis or sternocostalis. This is the parasagittal section of the abdominal and the thoracic cavity, where we are seeing the enlarged uterus having fetus inside. But here our concern, you want to clear about the spinal nerve. So what we are seeing here, this one is spinal cord. Okay. Here is the spinal cord and you are not clear about the spinal nerve. So just come here. Now come here. If we take horizontal section of a spinal cord, what we are seeing, there is butterfly shaped. In the middle there is butterfly shaped grey matter, and on the periphery this is the white matter. Okay. Now what we are seeing, on the ventral aspect this is ventral root, and on the dorsal aspect, dorsal or posterior you can say, this is the dorsal root, and this elevated one is the dorsal root ganglia. Okay. This is ventral root and this is dorsal root. Both unite to form one spinal nerve, which comes out through intervertebral foramen. This is a spinal nerve. Now this spinal nerve again divide into two. That is, on the ventral aspect there is ventral rami, and on the dorsal aspect is the dorsal rami. This ventral root is purely motor. This dorsal root is purely sensory. But here at the level of spinal nerve, both are mixed. And again in the rami, ventral rami and the dorsal rami, in both they are mixed. Motor for giving command to the muscle and sensory for taking sensation from the skin of that part. Ventral rami is entitled for supplying the ventral two-third, whereas the dorsal rami is entitled for dorsal one-third of our whole body. This is from the respective spinal segment. Is it clear now?
Yes, ma'am.
This is what we are seeing is the cerebral hemisphere. Here is the temporal lobe, this is frontal lobe, this is parietal lobe, this is occipital lobe, and here is the cerebellum, midbrain, pons, medulla oblongata, passes through foramen magnum. This is our spinal cord, and these are the spinal segment. If we take cut section, horizontal cut section, what we are seeing, there is a butterfly shaped centrally grey matter, and this is our central canal of a spinal cord. Okay. And in the periphery, this is white matter. Okay. And from there, the nerves are coming out, the bunch of nerve. This is on the ventral aspect, this is ventral root. And on the dorsal aspect, this is dorsal root. Now these two, here is one ganglia, these two unite. And now it is known as a spinal nerve, which we are talking that 31 pair of spinal nerve. And now again it divide. On the ventral aspect, this is ventral rami. And on the dorsal aspect, this is dorsal rami. What is the difference between ventral root and the ventral rami? Ventral root is purely motor. Motor is what? Giving command. Purely motor. They are the descending tracts. And these are the purely sensory. And a spinal nerve is mixed. And here again, in the rami, they are mixed. This fiber, if we have having two color pen, suppose you have got only blue. No? Now, this is the horizontal section of the spinal cord, and these are the ventral horn, and these are the dorsal horn, and these are the grey matter, and these nerves are coming out. This is dorsal root, and this is ventral root. Dorsal root is purely sensory, and ventral root is purely motor. Suppose in orange color, this is the motor nerve, and in blue color, this is sensory nerve. Now at this region, they are both mixed. So spinal nerve is mixed. Spinal nerve is mixed. What we are seeing? This nerve is coming from here and this nerve is coming here. At this region, where it is known as spinal nerve, it is mixed nerve. Now, this again divide, and this one also. Now both these rami has two type of nerve, that both sensory as well as motor. And this is known as ventral rami, and this one is dorsal rami. Both motor and sensory component. This is for the ventral 2/3 of the body, and this one is dorsal 1/3 of the body. Clear?
Ventral 2/3 and dorsal.
अगर हम ऐसे बीचों बीच काट देते हैं, तो ऐसे बीचों बीच काट देते हैं, तो ventral 2/3. This is for ventral rami.
अच्छा.
And dorsal 1/3. Sorry. Dorsal rami.